Hi folks, it's Marvin Music with MedicareSchool.com, and we want to welcome you to our event this evening. Glad that you've joined us. We were not here last week. I was actually out of town and was not able to have this, and I missed it immensely, so glad that you're with us tonight. I am going to be covering a topic that I hope will be very helpful, and then after just a brief explanation and teaching on that topic, I will begin to take your questions. Our producer, Daniel, is with me in studio, and so we are going to take as many questions as we can. I normally wear out by about 6:30, so probably have to cut off there if we have that many questions. But if you have a question about anything Medicare related, Social Security questions, please, you can begin to actually put those in the chat right now, and we will get to as many of those as possible. One favor, though we appreciate brevity, don't be so brief where I cannot understand your question. Sometimes people abbreviate and try to make it fast, and then we don't know what you're asking, so I want to be able to help you. So be sure that I can really understand what you're asking me. All right, so excited to get to those here. Let's just talk first off, before we get into the questions, about Medicare penalties. There are actually three different penalties that I want to draw your attention to tonight. Medicare has some other different penalty kind of aspects if we don't do things at the right time, but these are critical. And so the first one has to do with Medicare Part B penalties, Part B penalties. Now, Part B penalties are lifetime. So let me explain how you can avoid Part B penalties. Part B penalties happen when people do not go on Medicare Part B when they should. Now, there's actually 5 different groups of people that should and really must start Medicare at 65. And so if you're watching tonight and you're in one of these 5 groups of people, you have to start Medicare at 65. And if not, you're going to be penalized. And again, you're going to get a penalty for life. And so we call this opportunity to start Medicare at 65 your initial enrollment period. We use the acronym IEP. And the key to understanding the IEP is who has to go on Medicare during the IEP. Well, one of 5 groups. Number 1, anyone who is no longer working or their spouse is no longer working. You have to enroll into Medicare during your IEP. Anyone who's covered by COBRA insurance at 65, you have to take Medicare A and B. Now, if you keep COBRA for a short time, and sometimes that's fine, no more than 6 months, but if we have COBRA, what happens is the COBRA insurance company at 65 will move to the second payer. That's why you have to enroll into A and B at 65 to put Medicare in the first payer position. And if you don't, you become the first payer, and you don't want to do that. All right, so we're starting Medicare at 65 if we're on COBRA. Number 3, anyone that's retired from the military. You are eligible for what is called TRICARE insurance. And you have TRICARE insurance. It's wonderful insurance, but it's like COBRA. At 65, TRICARE moves to second payer position. Medicare pays first. If you don't enroll in Medicare A and B at 65, you are the first payer. And then anyone who is covered by a small employer-provided plan, same thing happens. Small employers are defined by Medicare to be 19 employees on the payroll or fewer, 19 or less on the payroll. Then what happens is you must enroll in Medicare A and B, put them in the first payer position. Your group plan at work is now going to pay second to Medicare. And again, if you don't enroll, you become the first payer. And then lastly, anyone that's on Affordable Care Act plan, you also have to start Medicare at 65. It's called an ACA, Affordable Care Act plan. You went through the Healthcare Exchange or the healthcare.gov website, and you set up an individual plan or a family plan. And so here's what happens at 65 if you're on an ACA plan. If you have any kind of a benefit, like a subsidy from the federal government, a reduced premium. There's cost sharing by the federal government. There are tax subsidies. There's a variety of ways in which you're incentivized financially on ACA plans. Now, I know not everyone gets a financial incentive, but many, many people do. So what happens at 65, if you're getting a financial incentive, reduced premium, cost sharing, tax subsidies, all those things go away at 65. So if you stay on an ACA plan at 65, you will pay the full premium. There's no tax subsidy whatsoever, no cost sharing. So there's no reason for you to stay on an individual ACA plan at 65, you're going to go into Medicare at 65. So here's my point. Those 5 groups of people, anyone no longer working, spouse no longer working, on COBRA, on TRICARE, small employers, ACA plans, you have to go on Medicare at 65. You're going to do so during your initial enrollment period. It lasts for 7 months, folks, 7 months, and that's it. So let's say my birthday was today. It's 5/7. Is today the 7th? Is that right, or 8th? I'm even not sure. 8th, sorry about that, 8th. And so if my birthday was today, I'm turning 65, I would be eligible to start my Medicare May 1. Okay, so my A and B dates would be May 1. I could actually enroll into Medicare 3 months before. That would have been April, that would have been March, that would have been February. So February, March, April were my 3 months before. My birth month is this month of May, and then 3 months after, June, July, August. So it was all the way from February to August. So my point is, it's a 7-month window that you must enroll into Medicare at 65. 7 months, 3 months before, the month you turn 65, 3 months after. And then what happens is if you don't enroll during that 7 months and you enroll later, then what happens is you're still eligible to do so, but you can only do so the first quarter of the year. And that would be January, February, March. And so if that happened to you now and you missed it, you wouldn't be able to enroll until 2026. And so for every 12 months, we go without Medicare when we should have had it, but we didn't have it because of a mistake or we didn't want to do it, whatever. For every 12 months we go without, we are going to have a 10% penalty added to our Part B premium for the rest of our life. Okay, so it's lifetime. So if I went without for 12 months, I would have a 10% penalty. This year, Part B premium is $185. They would add 10% to that. That would be $18.15 lifetime penalty. And so for every year I go without, I pay 10% and it's lifetime. So if I go without 24 months, that'd be a 20% penalty added for the rest of my life. So again, you don't want to miss your initial enrollment period. Now the second opportunity, what happens is that people that don't start Medicare at 65 because they didn't have to, because their spouse were still working, what happens is once that employment ends, officially, folks, you have 8 months from when the employment coverage ends to enroll into Medicare. Now listen, from a practical standpoint, I would never take those 8 months at all. Because if you don't enroll in A and B and you're retired, what do you have? You have COBRA. You're still the first payer. But officially, you have 8 months to come into Medicare if you are coming in after 65, as long as you are working back to 65. So we have 8 months. And again, you're not going to take it, but let's say you did. If you did not enroll during that 8-month window and you started Medicare again now, for every 12 months you went without, they're going to assess you that 10% penalty for life. So we want to make sure we start Medicare at the right time. Those of you that are going to continue to work, you're going to come in using what we call your special enrollment period. And the way to do that, the right way to do that, is to set your retirement date, and about 60 to 90 days before you retire, get all your Medicare set up. But if you didn't do it during that 60 to 90 day window, you still officially have 8 months. So get on it as fast as possible, because after that, now you'd be penalized. Okay, so that's penalty number 1, Part B, lifetime. Number 2, also Part D plans. These are drug plans. And so the way they work is same way on the starting at 65. We have 7 months to enroll into a drug plan, 3 months before, month of, 3 months after. And if we don't enroll during that 7-month window, then we can always pick up a drug plan, but we can only pick it up during the annual enrollment period for Medicare. That's October 15th to December 7th. And for every month I went without, if I did not take, during those 7-month windows, if I did not take a drug plan, I have a 1% penalty for every month I went without. So if you went without 12 months, you have a 12% penalty, which is basically about 40 cents a month, so about $4.80 for the year. But again, it's a lifetime penalty. And now, folks, my view is this. The penalties on Part D are not extreme. The biggest risk on not having a Part D plan is if you got prescribed an expensive medication, because you need a Part D plan to take advantage of that $2,000 max out-of-pocket cap on all prescriptions today. It's wonderful. $2,000. You could be on a medication. Had a lady the other day, medication was $13,500 every single month, and she'll pay $2,000 for the whole year. If she didn't have a drug plan, she'd be responsible for that $13,500 every single month. Probably couldn't do that. Probably would have to go without that medication. That's why you get a drug plan. Yes, you'll be penalized. That's minimal. The biggest risk is being without a drug plan. Those of you that are going to keep working, You don't have to take one at 65. You can take one when you retire, and you have 63 days from when the coverage ends at work to get on a Part D plan. And then if you haven't, then again, every month you go without, you got a 1% penalty for the rest of your life. All right, so that's that penalty. So those are the two financial penalties. And lastly, I want to mention this one, very important. And this is a financial penalty, but it comes about in a different way. And this is what we call the Medigap OEP. Medigap OEP. OEP is an acronym that stands for Open Enrollment Period. And the Open Enrollment Period is a key period for your Medigap policies if you want a Medigap policy without any underwriting. And most people do. They don't want to have to go through underwriting. So when you're first on Medicare, whether that's at 65 or at 67, once we have established your Medicare Part B date, that date, we have this 6-month window where we can apply 6 months prior to our B date and 6 months after our B date, and we can get any Medigap policy that is sold by any insurance company in our state. Now, if you're starting Medicare after 1/1/2020, which most of you are, you can't get Medigap C or Medigap F. Those are off. But you can get all the others, no underwriting, no health questions. The insurance company must approve your policy. They have to cover all your pre-existing conditions. They cannot charge you extra. It's a wonderful opportunity called the Medigap OEP. And unless you live in New York, Connecticut, or Massachusetts, this could be your one and only opportunity in every other state but New York, Connecticut, Massachusetts, where you can get a wonderful Medigap policy with no underwriting, no health check, no exams. We don't check your medications, nothing. That insurance company has to approve you. And so if you don't get one during that 6-month window and you want to pick up one later, now you have to go through that process called medical underwriting. And if you can't get approved, then you can only get a Medicare Advantage plan for the rest of your life. And that's why I'm saying you really have a severe penalty, because now you cannot get that quality Medicare supplemental plan called the Medigap OEP. So you do not want to miss that opportunity, especially those of you that have health problems. Okay? All right, so those are the penalties that we want to talk about. They're all lifetime, and we don't want anyone to have to go through the pain of those. All right, so that's it for tonight as far as the topic. I am excited about taking your questions. So, Daniel, when you're ready, I am ready to go. All right, Roseanne, if my monthly Medicare premium is more than my monthly Social Security benefit due to IRMAA, then what is the best way to pay this monthly Medicare premium? Okay, very good, yes. So what will happen is if your Social Security check is not enough to cover it all, they're just going to give you a direct bill for the entire amount. Okay, so, and I've had this happen a few times before, and so just know that they'll bill you, and so when they send you your first bill, it could be as low as 2 months, as high as 5 months. So remember that for all of you that are not on Social Security or in this situation where Roseanne is, where the premiums cannot be covered by the check, then your very first bill can be 2, 3, 4, 5 months. It's kind of like the lottery. And then after that first bill of 2, 3, 4, 5 months, then it will be every 3 months. So that's a direct bill. But if you don't want to be on that kind of a billing situation, which I wouldn't, I would set up some kind of an auto pay with Medicare. And they give you a couple options. You can enroll into what's called Medicare Easy Pay, and that means they'll do a monthly bank draft. You give them a routing number and account number, and on the 20th of each month, they will do a monthly draft. Or you can set up some kind of online arrangement through your mymedicare.gov site, and that would be fine as well. You can use credit cards for those if you want. Some people do that for points, but the point is it's a direct bill basis, or set up some kind of an ACH, EFT kind of arrangement, and you can pay that way. All right, let's keep going. All right, when do I have to apply? I was 64 in December. Okay, so that means you're going to be 65 in this December. And so, Janet, if you're not on Social Security, then just back up the clock 3 months. So your birthday is December, November, October, September. So any time after September 1, you can self-enroll into Medicare. And Janet, if you work with us, we're happy to do all that with you and for you. We do it all day long. Okay, so that's just a service we provide at no cost to you to make sure it's done correctly. So again, 3 months prior. Now, if you're on Social Security, let's see, you see you're not going to draw Social Security. Okay, so how are you going to pay for your Medicare? So again, just like I told the last person, you'll be set up on a direct bill basis. It's quarterly, other than the first premium could vary, or you can set up some kind of an ACH or a bank draft with Medicare and pay that way. And that's what I'd recommend, folks. I would personally wouldn't want to be on a direct bill because I wouldn't want to miss it. Okay, let's keep going. All right. All right. I plan to enroll in Medicare during month number 7 of my IEP.
Whoops, sorry.
Hey, it's all right.
So sorry.
Don't worry about it. Okay, we lost you there. Okay, will my COBRA insurance become secondary payer during that month? Okay, Andy, your COBRA is, from your birth month. Your birth month, that means that month 3 of that 7-month window, from that month on, month 4, that COBRA becomes the second payer. So you do not want to enroll into Medicare anything beyond your birth month. So in other words, you want to enroll in the first 3 months for sure of your IEP so that your Medicare begins on your birth month. So I wish I knew when your birth month was, but let's just say it's, let's say August. And so what's going to happen is you have 3 months before August, so that would be July, June, May. So May, June, July, you enroll in Medicare. Your Medicare A and B starts August. They pay first, and then your COBRA plan is going to pay second. But if you don't enroll until the 7th month, then from your birth month on, you become the first payer. And that's way too risky for $185 a month. Please. So be sure that you enroll in advance of your birth month. Okay, let me just keep going. Or will they become secondary during month number 4 of my IEP when I actually turn 65? So from your birth month on, they are the second payer. Birth month on. All right? And so that's why I'm saying you're going to enroll in 3 months in advance of your birth month so that A and B pays first, COBRA is going to pay second. And listen, Andy, I just wouldn't stay on your COBRA plan more than 6 months of your B date. Otherwise, you're going to have to medically qualify to get a Medicare supplemental plan. Now, the issue could be if your spouse or kids are covered on it, then you can keep that for 18 months is no problem. But as far as your coverage is concerned, you're going to go on Medicare, use COBRA for 6 months, and after that, get your supplemental coverage in place so you don't have to go through underwriting. That's the way to set that up, Andy. And all my agents know this, so they can help you with that. We'd be delighted to serve you in that way. Alrighty, can you go over the 1-year trial? Yes, I can. So whenever someone starts a Medicare Advantage plan, at 65. Let's just say we're doing it this month. Let's say that I turn 65 this month. It's May, and I decide at 65 to enroll in A and B 5/1/2025, and I start with an Advantage plan. What happens is that is called the trial right. So all the way from 5/1 of 2025 through the end of April of next year, I am in my trial right, which means at any time, any reason during that 12-month, I can cancel my Advantage plan and I can pick up a supplemental plan with no underwriting. I can also pick up a drug plan as well during that 12-month window. That's the trial right at 65. Now, for people that, let's say they start with the Medicare supplemental plan and then they're on that, let's say, supplemental plan for 3 years, and then they try an Advantage plan. They also have a trial right, but it's different because what happens is I'm on a sup for 3 years. I try an Advantage. Anytime during the 12 months of my trying the Advantage, I have the right to go back to the same supplemental company and the same supplemental plan that I had before. You can't just get any plan, any company you want. That previous company has to take you back. So that's the trial right for after 65 if you start on a supplemental plan. All right. Hope that helped. Let's go. I was laid off from work early November, haven't landed another job. When do I have to apply for Medicare while I continue to search for a job? I'm 67. Okay, very good. So here's your situation, Map. You're in a very risky position because you are the first payer right now. Okay, you are. And again, I don't know all the details of your insurance, but most people in your situation would now be on COBRA. So you need to be applying for A and B right now. I really would. But if you don't, you have 8 months from when your employer coverage ended. So I'm assuming it took you through the end of November 30th. Okay, so we have what? We have all of December, January, February, March, April, May, and June. Let me count that again. That would be December, January, February, March, April, May, June. That would be July. I'm sorry. Your 8-month window. Then during that 8-month window, you still have the right to come into Medicare A and B using the SEP. So that would be fine to get you enrolled in A and B. I am just saying right now you're just in a very risky position. So I wouldn't do that. I would apply this month, and I'd want my Medicare B to start 6/1. They're going to backdate your A date 6 months from this month. So they'll backdate A, but your B date could be a 6/1 date. Again, you don't have to take anything else because your COBRA plan, your work plan, will be fine in the secondary payer position. And then if you do find work and you like the coverage at work, meaning it's a better option than Medicare, then all you have to do is drop your Part B drop Part B. And then, you know what? And in fact, you know what, MEP? Let me rephrase that. That is not true. That is not true because you have 8 months, so you've already gone a period of time without credible coverage. So what I just said on the second part would not be accurate because you are going to have a gap in your coverage from employer-provided plan from 65 on. So you wouldn't want to do that. So your best bet, MEP, is to do exactly what I said, enroll in A and B now, and go ahead and keep your COBRA coverage as secondary to Medicare. But even if you do find a group plan, here's the problem you're going to have. If you drop your B, like I had first suggested, if you drop your B and want to pick up Medicare B at a later date, you're not going to qualify for an SEP because we have to verify you've had credible coverage for every single month back to 65 by an active employer-provided plan, and you cannot do that now. COBRA is not credible. And so your best bet really is once you go back to work, just keep the A and B, and then you can decide if you want the group plan to be in the second payer position or not even take the group plan and just go ahead and get your supplemental plan within 6 months of your B date. And that may be a more affordable option. And you may even tell your next employer, I have my own Medicare, I have my own insurance, and they may give you a pay increase or something because of that. I've seen that happen before. Okay, so the point is, sadly, you've shot yourself in the foot because you will not have a second SEP. Your SEP began November. So that's December, January, February, March, April, May, June, July. So yeah, you need to definitely be enrolled no later than the end of July for an August 1 start date. That's the longest, but again, very, very risky because you're the first payer right now. All right, let's keep going. Okay, is there a deductible for Medicare even though we pay for it every month and pay for a supplemental policy? Yes, there is. Now, all the supplemental plans will cover your Part A deductible. That's the hospital deductible. That's $1,676. So that's covered by your supplemental plan. The only deductible that's not covered today by your G plan or by your N plan would be the Medicare B deductible, and that's $257. It's an annual amount. Last year it was $240. This year it's $257. I don't know what it'll be next year, but it's just an annual deductible. You meet it once a year. So yes, you got to pay Medicare. Yes, you got to pay your supplemental plan, but the G plan will not cover the B deductible, nor will the N plan. All right, but they'll cover almost everything after that, but just not the deductible. Okay. All right, let's keep going. Okay, can you please address what IRMAA is? Yes, IRMAA is an acronym that stands for Income-Related Monthly Adjustment Amount. So it's IRMAA, Income-Related Monthly Adjustment Amount. And this is for people that are deemed to be or considered to be high income by Medicare standards. And those standards are, they set a threshold. So if you're a single filer in 2023 and you made above $106,000 modified adjusted gross income, MAGI, modified adjusted gross income, that's line 11 plus line 2A on your 2023 tax return. That's what they're going to look at. So if you're single above $106,000, you have an IRMAA. If you're a married couple that files a joint return and you're above $212,000 in 2023 modified adjusted gross income, then both of you that are on Medicare, if you both are, you're going to have an IRMAA. So those IRMAAs are surcharges added to Part B as well as to Part D plans for those that are considered to be high income. So anyone above 106 as a single filer, anybody above 212,000 will pay an IRMAA. There's 5 levels of IRMAA. The lowest IRMAA is about $85 a month. The highest one is over $500 a month. All right, and so 5 different levels of IRMAA. So there's additional surcharges. Now, if a person has a life-changing event, there's 8 possible life-changing events. Most people, it's work reduction or work stoppage, where you retired in 2024, you retire in 2025, you can appeal the IRMAA. They looked at 2023, you can say, hey, I've had a life-changing event. My income has changed because of that. You fill out paperwork. It's called an SSA 44. If you work with us, we'll do all this with you and for you. And you can appeal or ask for a reconsideration, giving them new financial numbers, either last year's or this year's, and they will drop off the IRMAA if you've had a life-changing event. That life-changing event has had to happen in the last 2 years. And so if it's this year, you can project your income for 2025. They won't look at 2023. You give them new numbers because you've said, hey, I've had this life-changing event. So again, we'll help you with that if you'd like. Good question. Let's keep going. Alrighty, I'm 66, but I do not want to retire yet. I'm still working full-time. What age is the latest age that I have to take Social Security before the Uncle Sam penalizes me? Okay.
I know the earliest age.
Oh, I said latest.
Well, they said latest, but I think
I have to
they're
take
asking about the earliest
before.
age
Okay.
without getting penalized.
Okay.
The latest age doesn't really.
Yeah. Okay. Well, here's the thing, Alice. You can delay taking your Social Security benefits up until age 70. And what's happening is right now you're probably very close to your full retirement age. If you're born in 1960 thereafter, which you're not because you're saying you're 66. So you probably had a full retirement age of either maybe 66 and 8 months or 10 months. And so once you've reached your full retirement age, then your Social Security account is going to continue to grow at 8% a year. And as far as being penalized by taking Social Security before full retirement age, once you hit it, there is no penalty. That's called an earnings test. So only those that have not yet reached full retirement age. And if I knew your birth date, I could tell you when that is. But if you were born in 1959, it is 66 and 10 months. 1958 was 66 and 8 months. So decide what your full retirement age, month and year is. And if you're taking Social Security anytime prior to that, then you can only make so much money at work. That's called the earnings test. And so it varies for people from 62 to 65. It's $23,400. For those that the year they turn 60, their full retirement age, this year it's $62,160. It's a lot of money. But once you hit full retirement age, you're never penalized. You can take Social Security, you can work make as much money as you want. And if you do decide to wait taking your Social Security, then your account starts growing at 8% a year after that. All right, hope that helps. Okay, I'm sorry, would entering into 1031 exchange avoid the IRMAA surcharge? Well, yeah, you're going to have to ask your accountant about that. I couldn't tell. I mean, I know what a 1031 exchange is, but I'm not an accountant. Okay, so anything, I will say it this way, anything that's reported on your tax return as income is going to affect the IRMAA because it's called your modified adjusted gross income, which is your AGI plus tax-exempt interest. So if it's in there for AGI, it's definitely going to count for IRMAA. So if you can avoid it through the 1031 exchange, that would be fine. I do know one thing about 1031 exchanges when it comes to doing like your own residence. Those 1031 exchanges do not then give you the right to have that exclusion for sure. And so I'm definitely aware of that because remember, a single person, we can exclude up to $250,000, married couple up to $500,000 worth of capital gain on our sale of our residence as long as we lived in it 2 of the last 5 years and owned it 2 of the last 5 years. But if you do a 1031 exchange, you do not qualify for the exclusion. That I know for sure. All right, let's keep going. I turned 65 in 2 months. I signed up for Medicare and ACA online. Do I have to wait 30 days to get a supplemental plan? Not at all. Mark, you're fine. You can get a supplemental plan anytime, and we would love to be your broker. We write in all 50 states, represent the majority of companies that are available today, and so give us a call. You can do it anytime. Now, your policy is not going to go into effect until your A and B starts, of course, but you can do all that in advance for sure. Okay, great question. And by the way, gang, I'm going to need to sit down. I've been standing here, but my back's starting to hurt. I am hurting, so we're just going to move the screen here just real quickly, and I'm going to sit down, and we'll keep at it. Thank you, Daniel. I have a bad back, and I can only stand so long. Okay, you good? All righty. Next question. All right, Don, had a Medicare guy call me and tell me I should select and sign up for Part G 6 months before my birth date, even before the IEP, which is fine. Can you sign up for Part G before getting the railroad, I guess what you're talking about, railroad card? And yes, you can. It varies, Don. Some states we can apply 3 months in advance, and some states 6. And the benefit of doing that is basically what you're doing is you're just locking in the rate and getting that taken care of. But again, that's why the guide suggested that. A lot of people are anxious to get it done, and we can make it happen. And if you want to wait, that's fine as well. But yeah, that was not bad advice at all from our guide. We do it all the time. Again, depending on the state, 3 to 6 months in advance is perfect. All right, let's keep going. Excuse me. All right, why is it that my husband has a higher rate for his Part B than I do? Well, I do not know. You all should have the same rate. If you file married, filing a joint return, then you should have the same. Now, if you did married filing a separate return, then that definitely could cause you to have different Part B premiums. And so I've just never had that happen, Diane, at all. So that'd be my only explanation. So if you want to write in, give me some more information, but there should be no reason whatsoever. It used to happen regularly whenever we went through a few years where there were no cost of living adjustments. We had that happen because of there's a rule called the I'm blanking on the rule right now, hold harmless. And hold harmless, we haven't used it for years. Hold harmless meant that if there was no cost of living adjustment, then if you're on Social Security, your Part B premium could not go up. So if someone was new to Medicare, they could have a higher premium than someone that had already been on Medicare. But that's been several years now. So I don't know of any other reason other than maybe he's been on it for a long time or something. But I don't think so. I think it has to be that you will file a separate return. The only thing I can think of. All right, let's keep going. Must I have my original Social Security blue-gray card to sign up for either Medicare or enrollment? I don't know. No, Brad, not at all. Not necessary. Yeah, I mean, you can order a replacement card to get one if you want in your possession, but that's not going to keep you at all. As long as you know the number and you answer, a few of the questions. If you're going to do this on your own, you do want to set up what's called a myssa.gov account, myssa. And I think most people today are using the login ID system. There's another one called ID.me. But just go online, and Brad, if you're ready to go on Medicare, we're happy to do that for you and with you. And if you want to start Social Security at the same time as your Medicare, all of our agents know how to do that as well. We can put both of those enrollments together. All right, next. Patsy, just wondering what your thoughts are on Minnesota supplemental plans as they appear to be different from much of the country. I'm going to be starting Medicare in the near future. Yeah, well, Patsy, what happened is Minnesota, Wisconsin, and Massachusetts are called waiver states. They have their own distinct plans. However, they're lookalike. So if you want a G plan or an N plan, it will not be called that in Minnesota, but it's just like that. They add some riders, but the coverage is identical. It's just called something differently. That's all. So it's not a problem, and that's the way Minnesota does it. But again, it's a lookalike. It will truly be identical to a G or an N. All right, why can't we buy an MA only plan and then buy the best standalone Part D plan that meets my needs? Well, here's why. Because the only time that you can get a standalone Part D plan, William, is if you have what is called a PFFS. It stands for Private Fee for Service. And those are a very distinct advantage plans. And those sometimes could include a D plan, but many times not. and that's the only time that you can get a standalone D plan is with a private fee-for-service. So if you want a drug plan with a Medicare Advantage, you're going to have to get a Medicare Advantage prescription drug plan. It's MAPD. If you do MA only, the only people that should do that are those that are retired from the federal government. They have FEHB or retired military, TRICARE, or those who get their scripts through the VA. That's the only ones that should ever get an MA only plan. I know what you're saying. Sometimes you'd like to pick out your own Part D plan, but unless it's a private fee-for-service, and there's not that many of those around, that'd be the only way you could do it. So if you live in an area, William, where they have private fee-for-service plans, and that private fee-for-service plan does not include a D plan, then you could get a standalone plan. All right, let's keep going. Hello, what are the steps to add a medication to my formulary so it's covered for the rest of the year? Okay, well, you actually have to ask for what's called a formulary exception. So all you have to do is call your company, and you may be able to get it, find this form online, but it's called a formulary exception. And then you fill that out. Your doctor's office could fill that out and get it to the plan. And I'd say probably 9 times out of 10, they will add that to your formulary. I'm not saying always, but usually they do. Now, it could be that the medication you want added, if it's a step therapy medication, you may have to try lower cost meds before they fill the brand name. I've seen that happen before. But if it's not in formulary, go through the formulary exception process, and usually you'll get it. Okay, let's keep going.
It's supposed to say Part B here, by the way, on this one.
Okay, question is that, what is the part of out of pocket include medications that are not within your drug? No, Gloria. For you to qualify for the $2,000 max out of pocket, it has to be a medication that you're getting through the plan that's in the plan formulary. Again, if you've got a formulary exception, then that would include it. But if it's out of the formulary, or you're not buying it through the plan, or you're buying it, through Canada or someplace, it's not going to be counted in the $2,000 max. All righty. We're still here. Here we go, Patty. If I take my large company's retirement health plan with Medicare A and B, and when I retire at 69, does that prevent me from switching to G or N without vetting down the road? Okay, Patty, it just depends on where you live. Okay, so the federal law says that that the only way you would be able to, let's say you did take your company plan, and you wanted to then later move to a G or an N plan. The federal law says that the only way that could happen where you would have a guaranteed issue on a G or N without no vetting is what you're calling it, then that plan would actually have to dissolve. In other words, it stopped. It was terminated by the company. Then yes, you would have no vetting. Okay, that's the federal law. There are a few states that have said that no, you would have a guaranteed issue right for a short period of time if you voluntarily or involuntarily lost that plan. So it's very risky. And this is what we tell people all the time. If you decide to take that retirement plan, and a lot of those are Advantage plans, and you say, I don't like it any longer, then you're going to have to go through medical underwriting almost always to be able to get onto a G or N plan. So it's very risky. So it truly just depends on the state that you live in. All right, Mike, my spouse works and has medical coverage for both of us. I'm retired. Do I have to get Part B now, or can I wait without penalty? First off, Mike, the employer payroll has to be 20 or more, okay? So that's the key. As long as there's 20 or more people on the payroll, then you don't have to do anything with Medicare A or B. Now, what about Medicare Advantage or supplemental plan? I turned 65 in August. No, same thing. So to have a supplemental plan or to have an Advantage plan, you have to be enrolled in A and B. So if they give you the right to delay taking B because you're covered by your wife's plan, 20 or more employees on the payroll, then you'll be able to pick up that supplemental plan or that Advantage plan in the future when she retires. So you are fine. I would tell you, Mike, this: if your wife is not contributing to an HSA, if she's not, no money going to an HSA, then I would still do A only, and then you'll pick up B at a later date, and again, you'll be able to get your SUP or Advantage at that time. If she has an HSA, don't do A, don't do B, do nothing at all. Okay, so those that have HSAs, I would say keep contributing to your HSA until you get ready to retire. Okay. So you are fine, Mike. Again, I was on a supplemental plan on my first year on Medicare. This year I went on an Advantage plan. Can I go back to a supplemental plan next year without any problems? Okay, Kent. What happened when you start with the sup and move to Advantage? If let's say you did that this year, you have 12 months from when that Advantage plan started to go back to your original MedSup plan, the plan you had in the carrier that you had, and there's no underwriting involved. If you stay on that Advantage plan more than 12 months, and now you want to pick up a new supplemental plan, yes, you will have to go through underwriting unless you live in New York, Connecticut, or Massachusetts. You will absolutely have to go through underwriting after that 12-month trial right. Okay, but remember, the trial right for you, you have to go back to the same company you had before, whoever that was. All right. Okay, Ronald, what makes more sense when choosing a supplemental G under a large group like United Healthcare or get a provider that does a plan by age, such as Mutual of Omaha? Well, they're all going to be based upon age unless you live in a community-rated state. So I'm really not really understanding what you're saying. Both of those companies are good. Mutual of Omaha is a great company. United Healthcare is a great company. I would just tell you that what I would look at if I were you is look and see who has the larger market share in your area, because normally whoever has the larger market share is going to be more stable long term. And again, I like Mutual. I'm not bad-mouthing them at all, but I would say we probably have people happier with the long-term stability of the rates with United Healthcare versus Mutual. Doesn't make them a bad company because they're not a bad company. But I'm just saying, as a general rule, I think UHC is probably a little bit more stable than Mutual of Omaha will be. That's all. So other than that, as far as large group, they're both going to be fairly large, but usually United Healthcare has a greater market share, which normally means more stable rates. Okay, but the rating of the carrier should be the same. I know how United Healthcare works. They do that enrollment discount. I think it's like 39% or 42%, and then they start taking away that enrollment discount every year, 3%. But as far as the ratings, it depends on the state, where you are. But I think you're fine either way. I'm just saying my experience has been UHC a little bit more stable. That's all. Let's keep going. Janet, my insurance is through my husband's employer. Thank you. He is retired, takes Social Security, but I am self-employed, so I still working. Do I have to apply? So your insurance is through. Okay, he's retired. He is retired. Yeah, so here's what happens. Jan, if we're interpreting this question correctly, you're saying that he's retired. So that means that he has Medicare A and B, and it's paying first. The retiree plan is paying second. And so you have to start your Medicare A and B if you're going to be covered by his retirement plan or your retirement plan. It doesn't matter. Only active employer-provided plans that have 20 employees on the payroll or more pay first. Retiree plans always pay second. So you will have to apply for Medicare A and B 3 months before your 65th birth month so that you can start at 65. And then if you stay on his plan, then that's fine. But it's going to pay second to Medicare for sure because it's not active. It sounds like to me he is retired. All right. That's the way I'd see it. Okay, do dual medical and Medicare plans have pre-authorizations? Yes, they do. Yeah, for those of you that would be new to this is somebody that's eligible for Medicaid and Medicare, and they go on dual eligible, we call them dual SNP plans for Medicare Advantage plans. So yes, all Advantage plans have pre-authorizations, all of them. I think right now about 70% of the services needed, whether it's a straight Medicare Advantage plan or a dual plan, is going to require pre-authorization on about 70% of the services. For sure, you have pre-authorizations. Alrighty, I'm planning to work until 70, turn 65 in December. I'm covered by my employer. If I understand correctly, I do not have to do anything until 3 months before turning 65, retiring, right? And that would be true, Larry. Yeah, by the way, you are 1 month older than me. I turned 65 in January, this coming January. So we're about the same age. So yeah, you don't have to do a thing. As long as your employer, Larry, has 20 employees on the payroll or more, you don't have to do A, you don't have to do B. And again, the only reason I wouldn't do A is if you have an HSA. If you're contributing to an HSA, don't do A, don't do B. But if you don't have an HSA, Larry, go ahead and enroll in A only. It's fine to do that. It's very simple to do it. It takes you 5 minutes to do it. And then what's nice about that is that you'll have that A only. Now, it'll be the second payer position, but Medicare A does pay coinsurance. And they may cover something that your group plan wouldn't cover at work. I've seen that happen as well. So it's fine to do A only. And I would do that unless you have an HSA. All right. And we'll be 65 in September. Currently have GEHA, FHB. I'm thinking correctly. This becomes my secondary insurance to Medicare A and B. That's right, Ann. As long as you enroll in A and B, your GEHA, FHB is going to be in the second payer position. Medicare A and B pays first. GEHA is going to pay second. Right now, I think most GEHA plans are also giving you an $800 credit towards your Part B. $800, it'd be an annual amount, but it kind of helps offset some of that expense of Medicare B. So they'll do that. And then I want to mention one other thing, and what some people are doing, and definitely not all, but we have it happen regularly. People in your position sometimes will enroll in what is called a Medicare Advantage only, MA only. Get your drugs through your GEHA plan. You get the discount that they give you because you enrolled in A and B, and then GEHA will actually coordinate the benefits with the Medicare Advantage plan. And you're probably saying, well, why would people do that? Well, because some of the perks that come along with that MA only plan. You get at least $100, $150 a month credit on your Part B because it's MA only. You're getting your drugs through the GEHA plan, so the Advantage plan doesn't have to pay for your drugs, so they give you a credit for that. And then hearing aids, dental allowance, a few other little perks that are offered that probably GEHA does not offer. And so again, GEHA will coordinate either with A and B or they'll coordinate with your Advantage plan. So some retired federal workers are doing that. And again, the nice thing is you're not really hurting yourself, because if you don't like it, you can always go back just to A and B with GEHA by itself. So it's just an annual decision. We see that a lot. All right, let's keep going. Still working, but don't have insurance through my job, so I have marketplace insurance until July. When I'm eligible for Medicare, can I keep working and only have Medicare? Absolutely. Yeah. In fact, Vanita, you're not going to want to keep your ACA plan because you'll pay full premium, no tax subsidies, no cost sharing. So you're definitely going to go on Medicare A and B and just pick a supplemental plan or get an Advantage plan, whatever's going to be best for you, and you have nothing from work. But it's fine to be on Medicare. Lots of people are working and are already on Medicare. Lots of them. Okay. Is there a maximum penalty percentage for delayed enrollment in Plan B and D? Yes. Yeah, there is. The maximum penalty would be annually. That's 10% a year, but that just keeps going and going and going. So if you went without 6 years, that'd be a 60% penalty added to Part B for the rest of your life. So in that, there's no max. But as far as there is a maximum on an annual basis, but it just keeps growing and growing and growing. So in that regard, there is no max. And drug plans as well. I've seen people that went without drug plans they started in 2006. We've had people who went without for 6 or 8 years. And, they're paying, 8 times 12 would be 96% penalty on Part D. So there's no cap on that at all other than the annual amount, 12% a year on drug, 10% a year on Part B. But each year it's just going to keep adding and adding. All right, I turned 65 this month, plan to retire at the end of July, and my work insurance will cover me on August. I would suspect you're a teacher, Carol. When should I apply for Medicare? My supplemental plan, I'm not taking Social Security right away. Okay, 65 this month, plan to retire at the end of July. Okay, works cover you through August. So it's May. And so if indeed you are a teacher, you probably are covered all the way through the end of August. So what I would do in that regard is this. May, June, July, August. So you want your coverage to begin in September. So May, June, July, August. Okay, so you can actually apply for A right now. I would definitely do that. And that way you have A only. And then what you're going to want to do in July is you're going to apply, cover me in August. Hang on just a second. I need to write this out. I don't want to mess this up for you at all, Carol. Give me just a second. Birthday's this month. So we're 5, 6, 7, 8, 9. Okay. All right, so what you can do, I'd apply for A only right now, as long as you don't have an HSA, take A only now. And then on your B, you're going to submit a form called the 40B, CMS 40B, and you submit that during the month of August. And on that 40B form, you request a 9/1/2025 start date on B, okay? Then you'll have a B date of 9/1/2025, same time that your insurance at work is going to end, since it ends in August. That's the way to do that. It would work perfectly. That's exactly what I do. But you don't want to submit it in July, because then they'll start your B in August. So if you submit in August, they start you the next month, which would be September. All right? And by the way, Carol, everything I said was true, unless your birthday was May 1. If it was May 1, then you're going to submit that in July, because you always have to move the clock back 1 month if you're born on the first day. But if your birthday is May 2nd to the end of this month, then what I just said to you is correct. We're going to take A only now. You'll have an A date of 5/1/2025. You're going to submit the CMS 40B form to your local Social Security office during the month of August, requesting a 9/1 start date. It'll go perfectly. By the way, Carol, our agents could coach you through all this as well if you want, some private attention. Okay. If your income level decreases over time below the IRMAA guidelines, does the penalty? Yes, it does. Every year they readjust the IRMAA schedules, the thresholds, and so every year it's going to adjust. And then also remember, if you have a life-changing event, then you can ask them to adjust it. But if your income stays up, they're just changing these on an annual basis. But if you have an appealable offense, death, divorce, marriage, work stoppage, work reduction, those are 5 of the 8. If you've had any of those happen, then you can also ask them to appeal it. Okay? Okay, I turned 65 in January of 2024. So over a year ago, then signed up for Medicare, not taking Social Security yet. I'm not full retirement age, work part-time, paid first 2 quarter payments, then lost my job. Was unable to make payments. Okay, so I guess what you're talking about, let's go back is that the same person?
Yes, they're saying they weren't able to continue paying for Part
Yeah,
B.
Part B, yeah. So what I would do,
Same person.
yeah, I would call the local office if you want to see if they'll backdate it, and if you paid it in full and you wanted them to backdate it, then can you go back to her other stuff for just a second? Turned 65 in January. Okay, so you could ask them if they will backdate if you make up the payments. If you can't do that, then your dilemma right now is you're beyond being able to enroll into Medicare right now. You're going to have to wait until the first quarter of next year. So I would call them and ask them, is there any way you can get reinstated, and see how much money it would take to do that if indeed you want your Medicare to start right now. Otherwise, what's going to happen, Shelby, is you're going to enroll into Medicare B, because you didn't lose your A, you just lost your B. You're going to enroll in January of 2026, and then your Medicare B will start February 2026, because that GEP enrollment, you can only do it the first quarter of the year. And so, we're in May, so you cannot enroll right now. Your only hope, if you want to start Medicare, if you have the money, is if they would backdate it and tell you how much money, what premium that you owe them, and that you may be able to do it that way. Otherwise, you're waiting till January next year. You mentioned that G or N coverage is the same for all insurance companies. That is the difference in premium, because the insurance company pays a higher different commission to the broker. No. Now, listen, there may be a little bit of difference between commissions. G does pay a tad bit more because we get paid a percentage of the total premium. But I will tell you, I mean, we definitely don't chase commissions. People get G plans because they can afford a little extra to get the most comprehensive plan on the market today. People get N plans, say, no, I want that premium savings of $30, $40, $50 a month, and they're willing to take on a little risk, not much, because you got some copays on the in plan, and you've got excess charges if they occur. So G&N is not about what the agent's going to make at all. It's about what's the best for you. Do you want most comprehensive? Get G. If you don't, N's a wonderful plan. They're both great, okay? Now, when I'm saying the coverage is the same, that is true. The premium is different in insurance companies because of their actuarial numbers, their medical loss ratios, their margins, their profit margins. So that's what makes the difference in premium. We'll have a company sometimes that they're really aggressive in one state, not so aggressive in another state. That varies. So that's really the actuaries that decide that for sure. So that, I promise you, it's not coverage is the same. Premium is varied just because the companies have decided, what they want their margins to be. That's what that boils down to. Has nothing to do with the commission because they're gonna pay us the same no matter what. Okay, hope that helps. Yeah, they don't listen, folks. When it comes to commissions, if you have agents that all they want to do is talk about Advantage plans, they're chasing commissions. Now, we write Advantage plans because some people, that's the best option for them. So we'll write it. But when you have an agent that only wants to talk about Advantage plans and won't talk about SUPs and the differences and advantages and disadvantages of both systems, then all they're doing is chasing commission. Advantage plans pay the agent about twice the commission. Lifetime residual income as well, not 6 years like SUPs. So, but it's not about G versus N on premiums, those kinds of things. I promise you it's not. Yeah. Okay, if I take energy to start with and then decide I can no longer afford it, am I stuck with it, or can I then go back to an Advantage? Absolutely. Yeah. What happens, Rick, if you do start with a supplemental plan, you can move to an Advantage plan once a year. That's October 15th to December 7th. And so that'd be the only restriction. And you can go to an Advantage plan any year during open enrollment. So you'd be on your supplemental plan through December 31st, and your Advantage plan then would go into effect January 1. And you can make that decision every year. That's called the Medicare AEP, annual enrollment period, October 15th to December 7th. Switch from SUP to Advantage anytime. All right. Who's next? Okay, so before 65 with job, can we start Medicare A and B? Well, you can apply for Medicare A and B 3 months prior to your birth month, but you can't start A and B unless you're on disability. People that are on Social Security disability actually start A and B on their 25th month of receiving their Social Security disability checks. People that have Lou Gehrig's disease, kidney failure, permanent kidney failure, in need of a transplant or dialysis, they can start Medicare before 65, but no one else can. So it's Lou Gehrig's, permanent kidney failure, people that are on Social Security disability. They start before 65, but no one else can at all. Apply 3 months before, but it won't start until your birth month. Okay, we are so new to this. What are the G plans? G plans are called supplemental plans. Hey, Kim, what I would do if you're new to this, of course, we have a YouTube channel, lots of information there. But if you will go to our website, medicareschool.com, I shoot every year a brand new version because numbers change every year. I do a version of what we call the Medicare Essentials Workshop. Kim, it is 50 minutes of your time well spent. You will learn so much. And then beyond that, we have a YouTube channel with probably 450 videos now, something like that. Anything you want to learn is on our YouTube channel. There's others, of course, that have great stuff out there as well. But that's what I would do, Kim. Do the Medicare Essentials Workshop, MedicareSchool.com website, and you'll enjoy it. You just will. It'll really help you, give you a great foundational knowledge of what you need to know. All right, thanks. Hey, that's all right. Daniel's looking for some unique questions as well. We know we get some of the same questions. Okay, what is the form I need to get from my HR department for a delayed start? That's called a L564. L564. And Andrew, here, let me just a word of advice on that. Part A, you can fill out. I see very few HR departments that initiate that form. So you can download it, CMS L564. You complete Section A, which is your employer's name and their address. They have to complete Section B and sign it and date it. That's verifying your insurance, verifying your work dates and all that. But here's the key, Andrew. that form cannot be submitted any prior to any sooner than 90 days prior to when you want your coverage to begin. If you submit it 6 months in advance, they're not going to process it. So again, that 60 to 90 day window prior to when you're going to retire is when you want to get that L564 and the CMS 40B form filled out. And Andrew, you reach out to us and we'll guide you through the whole process. Happy to do it. It'll be done right and be done on time. We'll complete all those that we can, email them to you to get to your HR department. All right, Glenn, I'm 67. I have United Healthcare Advantage, second to my 20-plus employee company health plan. Okay. Should I switch to a G supplement plan, and do I need a life-changing event to change? Okay.
Interesting situation.
Yeah. Well, Glenn, yeah, I honestly, very few people have done what you've done there. I'm not saying that was a bad decision. It really just depends on how long you have been on that Advantage plan. So if you've been on that Advantage plan less than 12 months, you can switch to a G plan with no underwriting involved. If you've been on the Advantage plan more than 12 months, then you're going to have to go through underwriting to do that. Now, there are a few states where there's exceptions, but normally to make that switch now, you have to medically qualify. So my question to you is, if you're concerned and your health is still good, this would be a good time to do it. Now, you can't do it right now. Unless you stopped working, you could do it now. But if you're going to keep working, then you can only make that switch during the Medicare AEP, which is October 15th to December 7th, or you can make the switch the first 3 months of the year. That's the time we can get off Advantage and pick up a supplemental plan. But Glenn, honestly, what I would do if you're going to keep working for a while, what I would consider doing, you're paying your Part B premium at least $185 a month. So what a lot of people do in your situation, if you have a good group plan, I would drop the Part B, which in essence then would drop your Advantage plan, have A only, and just be covered by your group plan. Since it has 20 or more, it's paying first anyways. So you're paying $185 a month to put your your Advantage plan to be in that second payer position. I just don't think that's a good use of money. That's what, $370 every 2 months. So multiply that time, you're talking $2,000 a year that you're paying for for that Advantage plan to be in the second payer position. I probably wouldn't do that. Now, if you have a lousy group plan at work, I could see doing that. But if it's that lousy, then what I would do is just drop it all together, and come Medicare open enrollment period, October 15th, December 7th, as long as you can qualify, I'd drop the Advantage plan and go on a Med Sup plan effective January 1. That's the way I would do that. Okay? Yeah, call in, Glenn. We can walk you through the whole thing. Your timing is, you just can't do all that yet. Okay? But we can get all set up. Okay, Albert, my wife and I used to be high wage earners, but 3 years ago I took disability, Social Security, and for the last 3 years our combined income is less than $200K. Does this affect IRMAA? Yeah, well, Albert, if you're starting Medicare this year, they're looking back at 2023. So what you made in 2022 and before that has nothing to do with your Medicare Part B. They readjust those numbers every year. So in 2026, they're going to look at 2024. So if you're a high earner 22 prior, it means nothing at all. Now, if you had a high income in 2023 and that's affecting you this year, then you can appeal your IRMAA. You can give them your retirement date of 2020. You can give them your new numbers for 2024 or 2025 because you retired in 2023. You could appeal that, and you would win that for sure. They look back too, therefore you have a right to use any kind of a life-changing event that happened in the last 2 years. That's Form SS44. Fill it out, get it to your local Social Security office, and appeal your IRMAA. It's called the reconsideration. All right, anybody else? Folks, we are looking for questions. Here we go. When going to the doctor for the first time, where do the medical bills come from? The insurance company or Medicare? Okay, so when you go to your doctor, you want to give them your Medicare A and B card and your supplemental card if that's what you choose to be covered by. A and B and a sup, if you have an Advantage, you just give them your Advantage card only. And so what happens is, let's say you have A and B and a sup, you give them the cards, you don't give them any money, and the provider has to file the claim with Medicare. Medicare is going to pay its part, and then they'll take the balance of what they didn't pay, and if it's the first claim of the year, they didn't pay the deductible for sure, $257. So that amount will then go to the supplemental company. And again, if you have a G plan or an N plan and you haven't yet met your deductible, then that bill will then go back to the doctor as unpaid because it's deductible applied, and then the provider is going to bill you. Okay, so that whole process could easily take 2 or 3 months, sometimes longer than that. But again, you don't pay at the doc's office. You pay. Now, if you have an Advantage plan, you'd pay at the doc's office, wherever the copay is. But if it's a supplemental plan, no money, let them file the claim. Medicare pays first, supplemental plan pays second. If you haven't met your deductible, they'll let the provider know that. Then the provider will bill you directly for that service, $30, $70, $150, whatever it is, up to the B deductible of $257 for the year. All right, in 2010, got Plan F, high deductible, no longer available, but I'm grandfathered. That's correct. Never hit the deductible, now $20.87 until this year, fearing a major increase in premium. Should I switch to a G or a high G? Okay. Okay, well, the question is, what caused you to hit the deductible? And so if that is some kind of an illness, an injury, chronic situation going on, then you may not be able to get off of your high deductible Plan F, because to get off of that F, you have to medically qualify to do that. So you're saying, should you switch to a G or a high G? I would say yes, as long as you can get through medical underwriting for sure. But again, what caused you to meet the 2870? If it was something that's, that wasn't chronic, it was just, something that was, an injury, or you had a knee replacement or something, you should be fine on something like that. But if it's something ongoing, then you may not be able to qualify to make the move. So my point is, if you can qualify, yes, I would do that. And I'm not like an enemy of high Gs, but it worked out for you because you stayed healthy, but you can see what happens. You have 2 problems. You got to meet the deductible every year, and if your health changes, you can't get off those plans. Okay. All right, does the annual deductible vary based on income? No. Medicare deductibles are the same. Part B this year is $257. Part A deductible is $1,676. And so no, those are all set by Medicare. The only thing that changes by income is your Medicare Part B premiums and your Part D premiums. Those have IRMAAs, those extra surcharges called IRMAAs. But income doesn't have anything to do with anything else. Nothing with Medicare, nothing with supplemental plans at all. Just B and D surcharges. Okay, my Social Security payment restarted due to an overpayment. Got it. I lost my supplemental in due to non-payment. Can I restart with my Aetna in plan? Thanks. Well, it just depends on how long. Normally, the grace period on supplemental plans is 30 to 45 days. So if you're beyond that, then you're going to have to reapply and go back through underwriting if you're beyond 6 months of your Medicare B date. Okay, yeah. So can you restart with that? What I would do, just call us, Joseph, and let's find out a little bit about your health situation, and then we can see if we can get you another plan. And Aetna's a good company, but again, usually after 45 days, then the grace period's over, and you have to reapply anyways. And I would just shop rates, make sure they're still competitive in your market. They may or may not be. That's what I'm saying. I'm going to call in and let us check that out for you first. All right. When is the last time I can contribute to my HSA if I am retiring in June and turn 65 in June? Okay, you can contribute up until May. If you're maxing out, you want to make sure no new money goes in effective June 1. Okay, so effective May. So sorry to confuse you there. You can contribute up until your birth month. Okay, so that for you would be May. Right now, you can put in about $430 a month if you're maxing out. So $430 times 5 would be your max. Yeah. So it's all prorated. So once your A date is started, there should be no new money going into your HSA. All righty. Okay, what in your opinion is the biggest drawback by going Medicare Advantage versus Medicare with a Plan G? Well, first off, Phil, I like G and I like N for Med Sup plans. And so the drawbacks on Medicare Advantage plans, there's actually a couple of them. The first one is they're network plans. That means that you definitely are not going to find every doctor. About the best we find right now is about maybe half the docs will take the plan. Half. That's the best. So you're going to have issues, possibly could have issues with doctors, specialists, oncologists, different providers. If a person has 4 or 5 doctors today, it is not impossible, but almost impossible to find one plan that takes that, that all those doctors are enrolled in that same plan. That's hard today. Now, if you have 1 or 2 doctors, that's not too hard. So the first one is network restrictions with Advantage plans. If you have an HMO, you can't go out of your network unless it costs you a lot of money, you pay out of pocket. If you're on a PPO, you can go out of network, but again, it costs you quite a bit to do that. So that's an issue. You got to stay within your network if you really want to make it work financially. The second thing is all Advantage plans have the final say-so with certain healthcare services. About 70% of services have to be pre-approved. That means your doctor absolutely does not have the final say-so. The plan does. And they may say yes, but sometimes they delay. We'll have people that need a knee replacement. They'll say, no, you need therapy for 9 months, or you need a full hip replacement and we'll pay for a rod and that's it. All kinds of things Advantage plans will do, because think about it, they're in the business to make money. They're not benevolent. They're going to have to cover you if it's necessary, but if they can't, they don't believe it's medically necessary, then they're going to delay that coverage or deny that coverage. And you can do a lot of online reading. You see some of the horror stories that people go through with Advantage plans. Now, that doesn't happen to everyone. Some people have had good experiences, but others have had terrible experiences. You just don't know. I kind of like the little joke about a recession is when my neighbor loses his house. A depression is when I lose mine. So pre-authorization is no big deal if yours got approved, but if it doesn't get approved, that's going to be a big deal. And so the whole point is people deal with pre-authorization on Advantage plans. The third thing is they can change every year. Last year, we had some of the carriers, they dropped 10% of their plans. Gone. They're no longer available. We'll have hospital groups say, we're not taking Advantage plans anymore. They pay us low, they pay us slow, and they're not interested. So sometimes it's difficult with networks for just hospitals. Your hospital may not want to take your plan. That's problematic. They change every year. They're not portable. You move away, you got to find a different Advantage plan wherever you move to. All those things we never encounter with supplemental plans. Supplemental plans are lifetime, no networks, go anywhere that takes Medicare, never pre-authorization by the supplemental company. Again, they're portable. So again, you got to pay a premium for it. So that's what, in my opinion, boils down to. You pay a premium, but what do you get for it? I think you get a lot for it, for sure. But the bottom line is some people can't afford the premium or they don't want to afford it. Well, then the Advantage plan is great for that. A whole lot better than A and B only for sure. You just have to decide, what's important to you. And if some of those features I mentioned are not important to you and you want to get Advantage because they're cheap monthly and they have some perks, then get an Advantage plan. Just know there are a few drawbacks that you may have to live with. And one of the biggest ones is, Phil, if you stay on that Advantage plan more than a year and want to get off of it, unless you live in New York, Connecticut, or Massachusetts, you have to medically qualify to get off of it. So those people that have health problems, they're on their Advantage plans the rest of their life. They can't get off. That's a problem. In fact, what's interesting, I just read this stat today. 90% of all people that are on Advantage plans are not in a guaranteed issue right. You hear that, Daniel? 90% have no GI right to get off of Advantage and move to a supplemental plan. Yeah. And that's what agents want. Agents want you in that status where you can't get off of it because they made a great initial commission, twice as much as SUPs, and lifetime residual versus SUPs that pay us for 6 years. So I'm telling you, folks, Advantage, the greatest advantage to the Advantage plan is for the agent and the insurance company. It's true. Yeah. And those of you that can't afford a supplemental plan, don't try to get one. Get an Advantage plan. That's where you need to be because you have to live within your means. There's people who would like to drive a Range Rover, right? But they can't afford it. They can afford a Nissan Rogue, then you better drive a Nissan Rogue. Don't try to get a Range Rover. You may like it, but if you can't afford it, you shouldn't try to do that. We all have to live within our means. And those of you that can afford a supplemental plan, I think it's money well spent. You may not think so, but you got to decide that. Let's keep going. All right, what is your number to contact sir? It's coming across the screen there. It's 833, there it is, 833-3661. And our office is open right now. I'm Central Time Zone. Our home office is in a suburb of Kansas City, Missouri called Overland Park, Kansas. We're right on the state line. We're open 7 to 7. So the switchboard's still open. Agents that are live. So we'd be happy to help you. Friday at 7 to 6 p.m., but Central Time. Let us know. We'd love to be your broker. No cost at all for us to help you folks. And we'll do everything and anything for you. Whatever you want, we'll help you with. Enroll in Social Security, Medicare at the same time, A and B, SEP paperwork, IRMAA appeals. Really, we do it all. And we have our own customer service team, which is great. Most insurance companies today send you over, overseas somewhere abroad, India, China, Philippines, somewhere. And a lot of times can't understand them, and I don't think they understand Medicare. But that's where these companies send you today, not our clients. Come right into our home office, and we invest a lot of money into customer service because we're committed to making sure you get taken care of, and no cost to you at all. All right, anything else, Daniel?
Yeah.
Here we go, Tom. Well, I just was going on my first Med G something with vertigo. I asked for a ear cleaning and checked to get Medicare G coverage. They want me to travel 80 miles back to my regular doc. Okay, let's go back. Just my first Medicare G something with vertigo. I asked for an ear cleaning and checked to get my Medicare G coverage. They want me to travel 80 miles back to my regular doc. Okay, well, I will tell you, I have never experienced that. So you must be on a Medicare Advantage plan, but you're saying you're on a supplemental plan. Well, number one, the insurance company didn't do that because the insurance company has no say-so. So I don't know who you have with your G plan, but there's no way they would have put that pre-authorization on you. Okay, now there could be some stipulations for earwax with Medicare. Okay, that could happen. But as far as traveling back 80 miles.
Who told them is what I want.
Yeah, Tom, if you wouldn't mind.
Was it the doctor's office that we went to? Like, who told them that?
Yeah, that's what we need to find out. Daniel, our producer, had a good point. And Tom, we'd be happy to help you with that. Why don't you call in? Call in right now.
I said supplement high G.
Oh, he had a high G?
Yeah.
Oh, I see. Okay, well, it is irrelevant, but regardless, it is irrelevant. If you have a high G, then you're just going to have to pay that first, almost $3,000 out of your pocket before that plan's going to cover anything. Medicare will cover their part, but your supplemental plan will not until you met the deductible. But as far as them asking you to go back to your doc, I just don't know that, unless you live that far from your doctor and that's who you want to go see. But I do know when it comes to earwax, there are some issues with Medicare and earwax. There are certain rules with that, and I'm sorry off the top of my head I can't say what those are, but I think if it's something that is impacted and has been a chronic issue, then I know that's going to be covered. Sorry that happened to you, Tom, and we're happy to help in any way, but that's all I have to say about that one. Okay. Yeah. Daniel just said it has to be deemed to be medically necessary, which that's what I was saying there. I know they cover that. A person just can't, go in without a problem and expect that to be covered. Anything else? Okay, am I planning on living as an expat overseas? How do I keep my Medicare available should I need it? Okay, Marcus, I am not an expert in that area. I think that as long as you have coverage overseas, that's provided by the government, you have proof of that, I think you would qualify for an SEP when you got back to the States. I think it works that way. But if you want to call your local Social Security office, that would probably be the safest way to check on that. Okay, just to make sure. But you're going to have some kind of credible coverage in order to not have penalties. Now, again, you're going to be eligible for Medicare because you have 40 quarters or more. So let's say you're overseas for 3 years and you didn't have any insurance and came back. Well, then you can still enroll into Medicare the first quarter of the year, but for every 12 months you went without Medicare Part B, you'd be assessed a 10% penalty. Okay, but I'm pretty sure that as long as there's some type of government-covered insurance, you have proof of that, then I believe you have a special enrollment period when you get back in the States. Okay?
Definitely check those.
Yeah, check it out. It varies country to country, so that's why I'm saying I've memorized all the rules in every country. Okay, what happens if you're on Medicare and sell your home? Does that impact anything? Well, if you have, here's the way it works. If you're single, the limits, it's called an exclusion amount, $250,000. A married couple, $500,000. And so as long as you own that property for 2 years of the last 5, lived in it 2 of the last 5, then that up to that amount I mentioned, single $250,000, married $500,000, would be excluded from capital gains. Okay, so then it would not have an impact on your Medicare premiums unless you were above those amounts. So if you truly qualify for the exclusion, you're not going to pay extra by selling your house. Okay, and by the way, I've got a video on our YouTube channel. You can Google that, couldn't they? Yeah, I got a whole video on that process on our YouTube channel that explains all that. It's called an exclusion. You got certain rules, and if it applies, only the money above that would be subject to the IRMAAs. All right, sounds good. Well, folks, thanks so much for being with us. We'll get again next Thursday night. Same time, same place. If we can help you in any way, please reach out to us. We'd love to serve as your broker. And like always, we'll be unbiased. We're going to give you honest help, information that you need, and no pressure. We just want to serve people and help people go on Medicare when it's the right time and doing the right thing. Take care. Have a good evening.